Good evening, I'm Dr. Allan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and entire tri-state community. We're going to talk about something very important to the community and to everyone. Everyone is touched by autism, developmental delays in children. We think about things, learning disabilities, different, and again, not to try to go over what's the politically correct term, and we'll hear about it from some experts today, but just the idea of children not doing as well intellectually, academically, and really trying to sort that out. I mean, there's a whole concept that if you look at some very famous people, who doesn't have autism? And again, not to make this at all a funny conversation because it's so devastating to so many families. We have two experts here in pediatrics who are going to help us talk about it. One person who really devotes her entire career to developmental issues. So we're going to talk to Dr. Ina Miroshnichenko. She's the chief, and I'm trying to get all the titles in my mind, Chief of Developmental Behavior at Richmond University Medical Center, which is a very unique specialty. If you think about it, going into a specialty to take care of families who have children with developmental delays, again, intellectual delays. There's all, as I said, trying to use the words, really it's really more from the heart than it is from what word I use for it. And we have Dr. Anna Mendez, who's the Chief of Ambulatory Pediatrics at Richmond University Medical Center, which I'm sure I've missed it by a little bit, but close enough, we'll say.
That was good.
Okay. Thank you both for being here.
Thank you.
So really, to talk about this really serious topic, and I have a pediatrician, an internist here, and someone who specializes in autism, but all pediatricians and all doctors really know about people who have these syndromes and the spectrum of disease. So as a general pediatrician, I'm going to go really to Anna first, then we'll talk a lot more with Ina about it. What do you look for? And you see kids from birth, and when I go to the hospital every day, and I'm a neurologist, I'm there, and interestingly enough, my practice has very few patients who come in with these syndromes because it's really been the spectrum of disease. We use the term autism spectrum. I really don't see that much by the time they come to over 21 as an adult neurologist. You, and I think about the pediatricians so much, going to the hospital, always coming in the morning very early with me before their hours to see the newborns. So you see them as early as you possibly can,
Yes.
and until they become 21 or even after 21. So tell us, what do you look for in your developmental evaluations? And what do you listen to the parents? And again, we always listen to the parents, but what key words do parents convey that we need to know about?
So seeing a kid is a partnership with parents. So we always have to bring questions and listen to what parents have to say. So when we do well-care visits from birth, on, in the first 3 years of their life, the brain is developing the most. So we see kids probably like 15 times as pediatricians in the first 3 years of life. So what do we do when they come in? We don't only look at their physical state, but we usually do developmental surveillance at every single visit, starting at 2 days of life.
Is there a checklist, or I know there's clinical judgment, but tell me, how do you get there? Because again, there's so much generality or gestalt. You look at something, we've done this for a number of years. I've done this a lot longer than anyone at the table because you guys are all so young. The question comes down to is it just looking at them, or is it something more that you could scientifically come across?
So the AAP, the American Academy of Pediatrics, has Bright Futures, and Bright Futures give the pediatricians the tools to do the developmental surveillance at every well-care visit. And then the American Academy of Pediatrics recommends complete developmental assessments at specific ages, 9, 18, and 30 months. Those are key ages to look at all the components of development: communication, motor, fine motor, problem solving, and interpersonal abilities of the child according to their age. So but we have tools that are there from 0 to 5 years of age. So what we do is we do at every well-care visit a surveillance. If the surveillance is abnormal or the kid was born premature, which puts them at very high risk of developmental delays, then immediately we will use the tools to do a screening. And if the screening is positive, we will refer to a developmental specialist and for therapies that will help the child reach their potential. So no matter what age they are, if they go for certain therapies, the brain is very neuroplastic from 0 to 3. We know by science that if we do that, the child will do better and increase their potential, whatever their potential is.
So, this is really your specialty, and I really want to spend much of my time listening to your expertise with this. But I'll ask you just a general question first. If mom sees that the child is not the same, and even though they meet all the developmental American Pediatric Association's guidelines, should they go a step further?
Absolutely, and I want to use this opportunity to talk to the parents about early intervention services, which are part of IDEA, Individuals for Disability Education Act, Part B. Early intervention services can be requested by parents. They don't have to go to, let's say it's a family who just relocated from a different area. They don't have the insurance, child is uninsured. They don't have a pediatrician, a doctor who can make a referral. So the family can self-refer. So if the child is from 0 to 36 months, basically from birth to 3 years, if parent has a concern about the child development, child behavior, or interpersonal relationship within the family, they can pick up the phone, call 311 and say, I'm concerned about my child.
And what happens next?
What happens next? Early intervention evaluator is going to visit the family at home.
And who is that? Is that a physician, occupational therapist?
It could be an
that?
occupational therapist, it could be a psychologist, it could be an early age educator who is specially trained to use the tools for the evaluation. So after the evaluation by early intervention is done, the individualized family service plan is developed. And it's interesting because it's not only for the child, but for the whole family.
And I just want to go through the steps of this because I'm not that familiar with it. It's available for people who speak different languages?
Absolutely. As a matter of fact, the evaluation is supposed to be done in the language, in the native language of the parents, of the family, which sometimes prolongs the process of the evaluation. But by law, this is the requirement. It has to be done in, for example, if the family is a Spanish-speaking family, it has to be done in Spanish. So immediately after that, services are available at home. Family doesn't have to travel. Speech and language pathologist, occupational therapist, physical therapist, special instruction teacher, ABA therapist can be discharged to the home of the family and deliver the services for the child. And it could
Do people know about this?
I'm hoping that after our show, a lot of parents are going to be educated about it.
And should they be leery about it? Is there any kind of enforcement issues, worrying that they're not taking care of their children properly? Any immigration issues? Anything with that people should be concerned about?
No. These are the services which, again, provided to young children by law. And everybody is eligible, regardless of the status.
So people should not be afraid of calling 311.
No.
With regard to this.
No.
That's very important. So we sort of have this 800-pound gorilla in the room. The word autism, spectrum disorder. A very interesting thing happened to me a few weeks ago, and I think I even called you up about it. That there was a woman who came in who was 25 years old who asked me, could you tell me if I have autism spectrum disorder? And I, again, being a clinician, neurologist, seeing people who've got different processes and having family members with this disorder, knowing a lot about it. The question really comes down to is you take a book out, and it's called DSM, it's a diagnostic, it's a psychiatry book, and there's different criteria for it. But as someone who does this, what are you looking at? Again, nobody needs a checklist of 5 things, whether there's automatisms, poor interactions, and things like that. And what do you look for in order to make the diagnosis?
Sure. So I do look at DSM-5 criteria. This is what we do for a living, right? And it comes to the point of how do you diagnose neurodevelopmental conditions, right? Psychiatric conditions, mental health conditions, a lot of neurological conditions. we have to acknowledge the fact that there is no simple test to help us to figure out this is ADHD, this is autism. Strep throat, Dr. Mendez sees the patient comes with the throat pain, fever, malaise, right, vomiting. You suspect pharyngitis, streptococcal pharyngitis. You do rapid strep test, you send the culture, throat culture, it comes back positive, you know what you're dealing with. There is no test which is going to show us that this is autism. There is no lab test, there is no imaging test which is going to help us to figure it out. That's why we have to create a possibility of being experienced, being exposed to these diseases, and knowing how to diagnose it. It comes with practice, it comes with knowledge.
So maybe just go even a little bit of DSM-5.
Sure.
Or whatever.
Yeah.
Just what the criteria are generally.
Before we do that,
Okay.
I
Tell me.
have to acknowledge the fact that we are all neurodiverse.
Exactly.
And talking to parents about it is extremely important. We are all different, right? We are quirky in our own ways.
Yes.
Maybe a little bit hyperactive, maybe a little bit inattentive, but it doesn't come as a disease, as a diagnosis, if you are still functional. If you are able to perform as a learner in school, right, as a parent, perform at your job, be a student in the university, then it's not a disease. So neurodiversity is a big part of it, especially when we talk about somebody who comes with the question and it seems like a high-functioning individual, maybe on the spectrum, maybe not. So then we look at the criteria. One of the criteria A, is social communication deficit. So you have to satisfy certain things. You have to be lacking certain qualities, and it has to affect your social interaction significantly for us to consider autism diagnosis. The second part, criteria B, is repetitive restrictive pattern of behavior. Typical thing when we talk about autism, a lot of parents are saying, my child doesn't flap hands, my child doesn't have spinning, or, running back and forth. Why do you think this criteria is satisfied? Restrictive pattern of thinking, inflexibility, right? Difficulties transitioning from one activity to another could be considered as repetitive restrictive pattern of behavior. And then the symptoms have to be present in early developmental period, as we've mentioned on just a couple of minutes ago, right? So when the child is young, the brain is still developing, or sometimes for high-functioning kids, it could be when the environment becomes more demanding in social aspect, for example. And that's why a lot of times girls are diagnosed later, and it's difficult for us to ascertain, do they satisfy the criteria or not? And last criteria is, can you explain it by anything else, right? Could it be some kind of genetic syndrome? Could it be an intellectual disability, for example? Not to mention the fact that two things can coexist, right? And using this opportunity, I want to tackle another myth that a lot of people think that if the child is on the spectrum, autism spectrum, their intellectual abilities are less. So 50-50. It could be highly intelligent child and still having the diagnosis of autism spectrum disorder, not to mention that a lot of kids who are on the spectrum have savant skills, right? They are so good at certain things which other typically developing kids are not. So, and again, it speaks for neurodiversity.
Okay. In the old days, a lot of it was just based on when your child spoke. Usually, especially with these type of problems,
Yes.
walking, usually motoric issues
Yes.
are not as prominent in this disorder. Is if they spoke at 2 years old, and you always ask the parents when did they speak, and that was the whole thing. But the criteria has
Yeah.
gotten much more
Stringent.
stringent in
Yes,
order to make the diagnosis.
absolutely.
So, do you think that then comes the next question? Why is the incidence so much higher than it had been in the past?
It's multifactorial. First of all, we are able to diagnose, screen, as Dr. Mendez said, it starts with developmental monitoring, and I think it has a lot to do with it. We, as pediatricians, become more comfortable with developmental screening. Nowadays, we involve parents into developmental screening. As a matter of fact, we just presented the study at National Conference AAP, American Academy of Pediatrics, showcasing how we were able to involve families into developmental monitoring through documenting the milestones, taking the pictures, taking short videos, and sharing it with the providers. So we're trying to get people who are next to their children, right, their parents, into developmental monitoring.
And we know early treatment is best in any disorder, whether it's high blood pressure, diabetes, anything you could think of.
Right.
So obviously early intervention is something that's crucial. What interventions are available?
So looking at the criteria, we were just talking about social communication deficit. Usually speech and language pathologist is a vital part of the team. And I have to say that, as we mentioned, the brain is so plastic from
You say
0 to
plastic.
5.
Tell me again, I can give you what I think about plasticity. What do you think about plasticity?
Yes. Recovery, regeneration, making new connections. Okay? So basically, if we're talking about therapies which are available for autism, ABA being one, applied behavior analysis, is basically behavioral shaping of the child. The earlier you start, the better results we're going to have. And that's, again, going back to early intervention services. Early intervention does offer ABA therapy, which I think is a very, very crucial piece for kids who are diagnosed younger. Because we do have a cohort of children who are diagnosed between 12 months and 24 months, and these are kids who are most likely moderately to severely affected by autism.
Is ABA the answer for, not, and again, I'm not saying this is a cure, but the treatment for everyone in that category?
ABA has about 35 years of practice and science behind it. ABA is not the only therapy which is available for autism spectrum disorder, but it's definitely covered by insurances. Even Medicaid nowadays covers ABA as most significant, scientifically proven therapy for autism spectrum disorder. But I have to emphasize the fact it's the team who treats the child. And when we talk about team, kids start school from pre-K3 in New York, right? This is very crucial because social communication deficit is there. We want kids to be interacting with others, specifically with peers, making connections. So making sure that the child has appropriate services in school, as you've mentioned, through the IEP, Individualized Educational Program in school, is extremely important. So when we talk about approach to management of autism treatment, unfortunately, we don't have etiological treatment, right? We don't know what causes autism, and therefore, it's difficult for us to have, this is one thing which is going to treat it. We don't have it.
Families will always ask, could someone with autism at one age be evaluated at another time, a few years later, with certain interventions, and be told they don't have autism?
About 10% of kids would lose the diagnosis, believe it or not. Yeah, science says, especially kids who were diagnosed younger and with lighter forms of autism. I'm talking about high-functioning autism.
Any medications for it?
So we did a show a year ago.
That's
we
right.
were talking about Rett syndrome.
I think we did.
Yes, so that's the only etiological treatment available nowadays. But what is hot nowadays, what we hear about, and a lot of my family is approaching me, Dr. Miroshnichenko, can you prescribe leucovorin for my child? This is a topic which I would like to address. Recently, about a month ago, AAP issued the statement, American Academy of Pediatrics, which is very respectful to the studies which we heard about related to improvement of certain symptoms of autism with kids who use leucovorin. But AAP nowadays does not recommend the treatment for kids who are on the spectrum. basically saying that we don't have enough evidence. It could change. We know that there is a FDA approval coming, probably within the next 6 to 12 months.
For leucovorin.
As a treatment for certain group of patients on the spectrum.
Because there have been medicines that have been tried or looked at, from oxytocin, all kinds of other things over say, a 20-year period of time, but they really never panned out. Sometimes we realize that over time, it just didn't work out well enough, or there were the side effects, or really the efficacy wasn't there using it long-term, and usually it falls out. And I see that so much even in my practice, that there are medicines that look like they're
very
wonderful,
promising.
Right, very promising. They can be a cure for Alzheimer's disease, MS, whatever. But we really don't see it even with this. The leucovorin studies, how long have they been out there for, and how long do they observe the patient for?
So it's all started in 2003, when the certain condition was discovered, cerebral folate deficiency, which can present like autism, but much more severe in terms of developmental impairment, in terms of neurological impairment, cognitive impairment. So what usually happens that folate in the blood, the level of folate in the blood is normal, but folate in cerebral spinal fluid, in the brain, right, is much lower, due to certain things. Usually it's several genetic conditions which can cause this disease. So given leucovorin, which is folinic acid, which basically is folate but in very active form, improved the situation
which is a vitamin B.
Which is vitamin B9, okay? But folinic acid is basically charged, so it doesn't have to have a specific enzyme to activate it. And another quality, which is very important, it crosses blood-brain barrier.
It gets into the brain.
Yes, exactly. So these kids benefit from leucovorin significantly. Okay, but how do we know if the child on the spectrum has low level of folate in the brain? We would have to do lumbar puncture. So there are some tests which are experimental tests, which are available now. They are measuring the level of folate receptor antibodies. And it's a little bit of speculation that if there are antibodies, then the child could have potentially lower level of folate in the brain, and therefore leucovorin might help.
But it sounds
not convincing.
It says at this point that you're not prescribing it to the group that
I do not prescribe. I follow AAP recommendation. It doesn't say that. It doesn't mean that I don't see families who get other providers prescribe leucovorin for their children, and I cannot judge their decision. I think it has to be a shared decision making. We have to educate the families about availability of potential treatments, but also we have to provide their scientific evidence. And what we know now that yes, there are several studies within the last 20 years, but the sample size is unfortunately small. We don't have clinical trials, large clinical trials, which are going to give us
you're looking for a randomized study where percentage don't get it, percentage do get it, and see if there's a difference.
Yeah.
And families would say to you, is there any major side effects with folinic acid?
Yes, so it crosses blood-brain barrier. It's an active substance. Therefore, it could be neutral. It could have positive effect, or it could have negative effect. So typical side effects are behavioral changes, sometimes behavior not improving, but deteriorating. GI symptoms, nausea, vomiting, headaches. A lot of times we have kids who are nonverbal, and for them to express that their head hurts could be difficult things. So there are potential side effects.
So I'm going to jump ahead to some other. When we talked about one, I think that was important because so many of our families read about it, and I've seen it in so much of the literature also. The use of other kinds of medicines, more psychiatric medicines, more for behavioral issues. And just to be brief, antidepressants, and various medicines for tantrums. How do you, of course we want to manage all these things with behavioral intervention if we could. But sometimes you can't. And tell us just again, we only have a couple of minutes left. What is your thinking about this? How do you decide when do you put a kid or a child on something like this?
Sure. That's an excellent question, because part of what I do is prescribing the medications, right? It's always a discussion about benefits versus risks. If we're talking about safety, comorbid condition, let's say it's a child with autism spectrum disorder and comorbid ADHD, and the child has aggressive behavior, self-injurious behavior, impulsive behavior, causing safety concerns for themselves, crossing the street without looking, getting lost in public places, right? Jumping from high places, low pain tolerance, they get injured a lot. I make sure that the child has support in school, the child has support in the community, exhaust any options available. Still the same situation, safety concern. Of course, it's going to be a discussion with the parents about potential use of stimulant or non-stimulant medications. If we talk about irritable behavior, aggressive behavior, the child has autism spectrum disorder, let's say severe form. The use of antipsychotics is FDA approved. There are 2 medications that we can offer, Risperidone and Abilify, for kids who are 5 or 6 years of age. Again, small doses, slowly introducing the medication and carefully watching for the side effects and positive effects. Does the medication work? Is there a benefit, or we are facing significant side effects?
Also, seizures are seen in people on the spectrum, autism
About 10%
spectrum.
of the kids, yes.
And I've seen that again. They respond to the same medicines, and thank God that their seizures usually are not harder to treat than other people's with this. When these kids with autism age out, you're a pediatrician. What happens when they're over 21?
So we talk about transition of care and pediatrics.
Yeah.
We started, believe it or not, at 12. So talking about self-management, right? Somebody who, for example, has chronic condition, diabetes, right? Or ADHD, severe ADHD, child has been on the medication for, let's say, several years, and the child is 12 years of age. So talking about the importance of knowing the dose, knowing the name of the medication, safe storage of the medication, making sure you don't share the medication with others, knowing your allergies and how you respond to the medication is very important. We strive to, by age 21, make sure that they are ready, can self-manage, and have all the qualities to be self-managing young adults.
And I'm going to say thank you, because we're actually coming to the end.
Yeah.
Who takes care of them? Do you go past 21, or are they?
Sometimes.
Sometimes. And I want to thank both of you. I mean, what a difficult and important topic that we're talking about. And I want to wish everybody a good evening. And basically, the things that are available and the education that's available now for autism is tremendous. And hopefully we'll make some more strides for it in the very near future to help with this devastating disorder. Have a good night, everyone.